This is Sue Birch sharing with you a webinar about the Affordable Care Act implementation here in Colorado. The goal of this webinar is to provide nurses a high-level overview of the Affordable Care Act and update you on what steps Colorado is taking to implement the law. On the webinar, we are going to cover the following topics: an overview of the Affordable Care Act, including who does what, changes to the public and private insurance, expansion impact on Colorado, including expanding Medicaid's provider network, key dates, how to apply, customer support for clients and applicants, and why nurses are so key in getting Coloradans covered. The Department of Healthcare Policy and Financing administers the Medicaid and Child Health Plan Plus programs, as well as a variety of other programs for low-income Coloradans, families, children, pregnant women, the elderly, people with disabilities, and some adults without children. The mission of the department is to improve healthcare access and outcomes for the people we serve while demonstrating sound stewardship of financial resources. In August 2013, there were 731,093 Coloradans enrolled in Medicaid and 69,087 Coloradans enrolled in Children's Health Plan Plus. 60% of Medicaid clients are children 20 and under. The Affordable Care Act has broad impacts across both public and private insurance providers and impacts on Coloradans who currently have coverage and those without health insurance coverage. The goals of healthcare reform are to protect consumers, improve affordability, hold insurers accountable, expand coverage to those who are currently uninsured, contain costs for public-private programs to ensure fiscal sustainability, and crack down on waste, fraud, and abuse in Medicare and Medicaid. Currently, 15% of Colorado's non-elderly residents are uninsured, of whom 90% may qualify for Medicaid or for financial assistance to buy coverage on Connect for Health Colorado Marketplace. Again, that's approximately 800,000 Coloradans who are uninsured. The law helps to expand coverage in Colorado through the Medicaid expansion that will provide more coverage to adults without kids and parents beginning in January of 2014. Also, Connect for Health Colorado provides a new way for Coloradans to shop for health insurance coverage and possibly get financial assistance to lower the cost of premiums. Additionally, more Coloradans will have access to care through increased investments in workforce and clinic capacity. The law also includes numerous insurance reforms and consumer protections, including dependent care coverage for adult children extended to age 26. It also includes insurance companies beginning in 2014 can no longer exclude coverage due to a pre-existing condition, set annual or lifetime limits, rescind coverage, as well as no longer charge different rates due to gender or health status. And lastly, additional preventative care is free. The Healthcare Reform Act also puts in motion ways for the state to help contain healthcare costs. In Colorado, we are implementing numerous programs such as coordinated care models in Colorado, our delivery system reforms, advancing patient-centered health homes, reforming payment systems, the payment reform pilot program in the accountable care collaboratives, benefit design and benefits collaborative processes, and integrating care to physical, behavioral, dental, long-term services support, and public health efforts, which will help us prevent and manage chronic disease better. We're also leveraging health information technologies and using advanced data analytics with our statewide data and analytics contractor. Health plans are now required to allow parents to keep their children under age 26 without job-based coverage on their family coverage. As of December 2011, 50,000 young adults here in Colorado gained insurance coverage as a result of the healthcare law. In 2011 and 2012, 1.2 million in Colorado with private health insurance gained preventative service coverage with no cost sharing. The changes that are to come include, as of October 2013, our Connect for Health Colorado Marketplace opened. Our Medicaid expansion population began to apply in October of 2013. In January 2014, the coverage purchased through Connect for Health Colorado and the Medicaid expansion coverage begins. Also in January 2014, the individual mandate begins. Our insurance companies are barred from denying coverage or imposing annual limits in January 2014. In 2015, the employer mandate begins. In 2016, the long-term care benefit is available. In 2018, the federal tax on high-value benefit package begins. The changing healthcare landscape necessitates that we work together here in Colorado, working closely with all our partners and collaborating across state agencies. Healthcare policy and financing works closely with the Colorado Department of Public Health and Environment, the Department of Human Services, the Department of Regulatory Affairs, and Connect for Health Colorado to implement healthcare reform in a way that meets the needs of Coloradans. For example, we work with Departments of Human Services, Office of Behavioral Health, working closely together to administer the behavioral health and substance abuse benefits. We work with the Colorado Department of Public Health Environment in health promotion and prevention programs. With Department of Regulatory Affairs, Division of Insurance, we work closely as they regulate private insurance and certify marketplace health plans. And lastly, Connect for Health Colorado on having a single application for all medical programs and Connect for Health Colorado, as well as by sharing data and providing consumers a no wrong door approach to applying for coverage. Now, what is the marketplace? Here in Colorado, the Connect for Health Colorado is our new health insurance marketplace. It was previously known as the Exchange. The new marketplace is for businesses with 2 to 50 employees, Coloradans who buy their own health insurance, and those who are uninsured or don't have access to affordable coverage through their employer. Connect for Health Colorado will be the only place where Coloradans can access new federal financial assistance based on income to reduce the cost of their health insurance. Through the online marketplace, Coloradans will be able to see if they qualify for a new kind of tax credit to lower the cost of premiums and reduce copays and deductibles. New financial help will be available to nearly 500,000 Coloradans based on their income. There are more ways to get insurance, and healthcare reform provides Coloradans with more options to obtain that healthcare coverage. Let's begin with Medicaid. Medicaid will provide expanded coverage to those up to 133% of the federal poverty limit. You may be eligible for Medicaid if you are an individual making about $15,000 per year, a family of 2 making about $20,500 per year, a family of 3 making about $27,000 per year, or a family of 4 making about $31,000. Children's health plan will remain the same and still be available for children and pregnant women. The marketplace will provide options for financial assistance and to purchase health plans. Upfront financial help from the federal government to lower the cost of your premium, deductibles, and copays. If you are an individual making about $16,000 to $28,500 per year, a family of 2 making about $20,500 to $38,500 per year, a family of 3 making about $25,500 to $48,500 per year, or a family of 4 making about $31,000 to $58,500 per year. The healthcare reform and the Medicaid expansion have enormous economic impact on Colorado. Let me share with you some of those impacts. Colorado will gain 22,388 new jobs by 2026, including 14,357 in the first 18 months of implementation due to the expansion of Medicaid here in Colorado. Medicaid expansion will stimulate about $4.4 billion in economic activity and increase average annual household earnings by $608 a year by 2026. The Medicaid expansion population includes hardworking Coloradans that we encounter and depend upon every day. They are our friends and family and neighbors and include our nursing home employees, waiters, waitresses, bus drivers, school staff, and many service industry employees. The department expects approximately 160,000 newly Medicaid eligibles will enroll. Expanding coverage allows us to improve value. It allows more parents and adults without kids to have health care coverage. The department estimates approximately 160,000 Coloradans will become newly eligible and enrolled in Medicaid. Newly eligible Coloradans will be enrolled in our Accountable Care Collaborative, which is a new client-centered health care delivery model. Clients work with a health home that coordinates their care, ensuring they are seen at the right time, right place, and at the right cost. Currently, Colorado has 7 regional care collaborative organizations statewide. Now, our Medicaid provider network is expanding as well. Medicaid has seen over 8.5% increase in providers enrolling in the Medicaid program from 2011 to 2013. And the Centers for Medicare and Medicaid Services has approved Colorado's request for $7.7 million in additional federal funding for supplemental payments to Medicaid providers, including nurse practitioners and physicians who primarily practice in family medicine, internal medicine, and pediatric settings. Colorado is among the first 7 states to receive approval to pay supplemental payments which are retroactive to January 1, 2013. There are currently 4,116 eligible Medicaid physicians, nurse practitioners, and physician assistants who will receive an average increase of approximately $25 per office visit for primary care services. And if you or your facility is interested in becoming a participating Medicaid provider, I would encourage you to call our provider services at 1-800-237-0757. Now, there are key dates that you need to be aware of with healthcare reform. There are 3 key dates approaching. One, which just began, was October 1st, where we started having consumers research and apply for insurance affordability programs online at Connect for Health Colorado and Peak websites, in person, by mail, over the phone, or buying insurance through the marketplace. In January, coverage begins for the newly eligible Medicaid and for plans purchased through Connect for Health Colorado. And lastly, March 31st is the date that Connect for Health Colorado Marketplace open enrollment period closes. I do want to remind you that Medicaid does not have an open enrollment period. We accept consumers enrolling at any time throughout the year. I'd like to talk now about how to apply for coverage. Applicants can apply in a variety of ways, including online, by phone, in person, or by mail. Consumers can receive help completing an application in each of these ways as well. If a consumer is not sure where to start, have them call our customer service at 1-800-221-3943 or go to Connect for Health Colorado by calling 1-855-PLANS4U or visiting colorado.gov/health. Both the department and Connect for Health Colorado will be able to direct applicants to assistance. We know that consumers trust information from healthcare providers. A recent Kaiser Family Foundation poll found that 44% of respondents say they trust the information they receive from a nurse or a doctor. Knowing that consumers trust the information providers give them, we need your help connecting with the uninsured. With over 53,500 registered nurses in Colorado working together, we can reach those nearly 800,000 Coloradans who need coverage, and we can connect them to the right people and places to apply. Let's work together to make Colorado the healthiest state in our nation. Please, I ask you to ask your patients about their coverage and then direct them to our new sites. Clients and applicants can get more information via the phone from the department and Connect for Health Colorado. Also, consumers and healthcare providers can also seek assistance from the Division of Insurance in regards to any insurance questions, agents, or insurance companies by calling Consumer Affairs. Thank you for your time and your interest in helping make Colorado the healthiest state in the nation.